begin tonight's live discussion with a prayer to be followed by the Philippine National Anthem. God Almighty, we give glory to your mighty name. We thank you, O God, for gathering us tonight, a testament of your love and protection for the people who love and serve you. We thank you for our senses, most especially for the gift of sight, enabling us to see the wonders of your creation. Hear our prayer as we ask for understanding and wisdom, that we may be able to put in practical use the knowledge we will gain, especially to help those we meet in our daily tasks. May you be pleased, O God, that in everything we say and do, may we always give all glory to you. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, pero sa kasingatanan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa mandulupin, di ka pasisingil, sa nagagang tutok sa simoy at sa langit mong pagaw, ay hinatang tulad, awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na nagtitindig, ang bituin at araw niya kailan pamay di magtitindig. Lumalang araw ng walhagit pagsinta, buhay langit sa piling mo. Ang inigaya ng pagkay mga amin, ang mamatay ng dahil sa'yo.
Once again, good evening, everyone. Aside from Buwan ng Wika, which our teachers know very well, August is also Sight Saving Month. By the way, I am Miles Ong of the Dumaguete City Host Lions Club International, and I will be your host for tonight. Tonight's activity, collaboration of the Provincial Office of Negros Oriental, Fred Hallows Foundation Philippines, the Dumaguete City Host Lions Club International, and the Negros Oriental Chamber of Commerce and Industry. We also acknowledge our viewers for tonight, the DepEd teachers of the Negros Oriental and Dumaguete City Schools Division, Dumaguete City Private School teachers and principals, Dr. Maria Victoria Rondaris, Country Manager of Fred Hallows Foundation Philippines, Dr. Leland Estacion, Head of the Negros Oriental Provincial Health Office, the members of the Dumaguete City Host Lions Club, and the Negros Oriental Chamber of Commerce and Industry. Before we proceed further, we would like to remind everyone that this is a Zoom webinar. All attendees have their microphones and cameras turned off. You may share your comments and reactions in the chat box, and your questions to the Q&A section. Both are found below. For those who want e-certificates for this event's attendance, you may answer the poll question at the end of this webinar, and also a link of the online form will be posted at the chat box at the end of this event. By the way, we are also live on our Facebook page, the Dumaguete City Host Lions Club. As very practical information will be imparted to us, you can share the FB live feed with your loved ones as well. To formally open tonight's discussion, we would like to give the spotlight to the country manager of the Fred Hallows Foundation Philippines, Dr. Maria Victoria Rondaris.
Hello, good evening. What is the strongest sense in the human body? Yes, you're right. Your guess is right. It is the sense of sight. Having sight means to be able to see. It is the most dominant of all our senses because we tend to rely more on seeing rather than hearing or smell for information about our environment. Imagine being born with a clear eyesight only to lose mid-40s because of diabetes, or even losing it early in your teens because someone advised your parents that it is not good to give eyeglasses at such a young age. Sight and vision are important because they allow us to connect with our surroundings, keep us safe, and help maintain the sharpness of our minds. 80% of what we perceive comes through our sense of sight. By protecting your eyesight and by learning, share it with the children in your classrooms, we will all reduce the odds of blindness and vision loss, also while staying on top of any developing eye diseases such as cataracts, glaucoma, and the familial refractive errors. This early, I would like to congratulate the province of Negros Oriental for being one of the Fred Hollows Foundation's partner in promoting eye health through the Department of Health's Community Eye Health Program. You should be proud tonight of the tandem of eye health professionals right now to speak before you. Dr. Janice Yu, a young ophthalmologist whom I know, to talk on the prevention of diabetic retinopathy, and the energetic responsible Dr. Rheza Tabasuares on myopia and computer vision syndrome. Welcome to this evening's hour of learnings. Thank you for this invitation and maayong gabi sa tanan.
Thank you very much, Dr. Rondaris. And now we can officially start. Let us now welcome Mr. John Halandoni, the Executive Director of Negros Oriental Chamber of Commerce and Industry, to introduce our first speaker.
Good evening. It is my privilege to introduce our speaker tonight. And our speaker is a graduate of Cebu Doctors University in 2006. She ranked 8th in the 2006 optometrist licensure board examination. She has been actively practicing clinical optometry for 15 years already and focuses on myopia control and management. She also extends her time doing volunteer works at the Negros Oriental Provincial Hospital Eye Center. Her clinic is also a rotation center for optometry. Students from various optometry schools in the country where students can learn and experience the actual clinical optometry practice. She was a past Board of Trustee in 2016 to 2017, Vice President in 2017 to 2018, and past President 2018 to 2019 of the Optometric Association of the Philippines. She is now a member of the Professional OD Society, a group of young optometrists with a passion and vision to promote and advance Philippine optometry in Asia, a clinical research relevant eye care profession in the world. Ladies and gentlemen, please help me welcome Dr. Rheza Marisse Badon-Tabasuares.
Hi, everyone. Thank you, Mr. Halandoni, for that warm introduction. So tonight, let me just share my screen for a while. Okay. So tonight we will be discussing about computer vision syndrome and myopia. So I have chosen this topic, this problem actually, because because digital devices usage has increased substantially for the recent years, especially after the pandemic. And it's actually used for both social and professional purposes. So to start with, just to give you a brief information about what's happening in social media. So approximately we have 7.9 billion in the world, and 55%, we have 55.1% are social media users, active users, I mean. And then if you notice here, the average amount of time per day spent using social media is 2 hours and 22 minutes. So it means we have been using our eyes at near excessively. And next is, if you notice here, can you find the Philippines? It's actually here. We're actually ranked first for the number of daily hours time spent using social media. So there's a 4-hour at least average number of hours that we spend. And surprisingly, do you think that we will be surprised? But actually it is surprising. We ranked first. And the last in rank is Japan. So what do we do? What do we usually, what's the activities? What are those activities that we do? So 92.2% visited an online retail store, 81% searched online for a product or service to buy, and 40% sold the product online. So it means na medyo yung negosyo or mga businesses are picking up as well through online. And another one. For this one, so the world's most used social platform is Facebook. Next is YouTube. So we have 2.7 billion users of Facebook. Next is YouTube, which is 2.2 billion. And aside from using the gadgets or digital devices in social media, we also have online classes. We use it for online classes, virtual meetings. We also use it, also online classes, especially for our kids. So if you notice here, she used a mobile phone, a laptop, and another laptop as well. And the mom is helping her daughter. And another information here, according to the Social Weather Station Statistics for Advocacy, we have 87% who are currently enrolled in school, while 13% of the household members are not enrolled. So out of the 87%, 80% or we have approximately how many millions? 23.8 million who are into purely modular distance learning. 14% or 4.3 million are into online distance learning. So you notice here that 4.3 million are actually using mobile devices, digital devices, and even the modular distance learning, even though they just read through their modules and do their assignments through modules, their eyes are still used at near. And another information, approximately 52% are kids are enrolled. 45% are in elementary, 7% are in the pre-primary, and the least one is the 6% college level. So this brings my topic, computer vision syndrome. So most of you may have heard about computer vision syndrome, or what we call, another term for that is digital eye strain. So what's computer vision syndrome? This is actually characterized by a complex of eye and vision problems related to the activities at near. So this is experienced in relation or during the use of the computer. And this problem has been recognized already globally as a health problem for over 20 years. So for computer vision syndrome, what are the common symptoms? So we have eye-related symptoms, which are burning sensation, redness, dryness, or tearing. So on this orange colored symptoms, these are associated with or linked with dry eyes. For the green ones, we have blurring of vision, double vision, presbyopia, myopia, slowness of focus change. So these common symptoms, the green ones, are basically linked to focusing problem, focusing at near or when you look at the screen, you have some slowness of change and focus. And when you look at far, there's also a slowness in focus or clarity. So the green colored symptoms are basically focusing problems. And for the blue ones, we have the external factors, which is if you have some external problem factors, we have the common symptoms that would be neck pain, stiffness, neck stiffness, shoulder pain, headache, and backache. So maybe some of you or most of you who are listening right now, you may have experienced one or maybe most of these symptoms. So what are the contributing factors? So later on, before we reach to the contributing factors, when we use our digital devices, especially when we are into online learning or if we are at work, we use masks. So just to insert this MAID, or we call it mask-associated dry eye, this is actually a dry eye because of the wearing of mask. We know that wearing masks is essential to help reduce the spread of COVID-19, but it can actually cause dry eyes. So what's the cause? So it's actually when you wear the mask, the air breathing out is channeled up to the top of the mask and over the face of the eye. So it creates dry eyes. So our tears actually evaporates. So the movement of air over the eye causes tears to evaporate, leaving the surface of the eye to dry up. And then eyes, because of dryness, eyes may feel itchy, dry, gritty, or even watery and sometimes red because of wearing the mask. So we have some solution to that problem. First is to make sure that you ensure your mask fits well and consider taping the top edge of the mask for prolonged wear. Or you can just make sure that if there's the wire type mask, just press it here so that the air doesn't go up and will not create or cause dry eyes. But if the problem is already there and you think that you have those symptoms, try to lubricate your eyes. And then another thing is limit time in air-conditioned environments. But since we can't really limit our time, make sure if you have your workspace, you have some humidifiers, or just make sure that the temperature is not very cold. Okay, so I have here a very quick exercise. Maybe everyone can do this. Okay, so maybe perhaps all of you can write it in the chat box. How many seconds did you blink after? So for me, I blinked after 4 seconds. Definitely, I have dry eyes. I actually was diagnosed with dry eyes, so I put some lubricants as well. But perhaps some of you can put it in our chat box. How many seconds did you blink? So anyway, so these are the contributing factors to CVS, or computer vision syndrome. So some personal factors are poor sitting posture, look here, and improper viewing distance, improper viewing angle, some ocular diseases or problems or ocular pathologies, medical diseases, and aging can also contribute to CVS. For environmental factors, we have poor lighting, imbalanced light between the computer screen and the surrounding. And factors contributing to CVS for the computer, poor resolution, poor contrast, glare of the display, and slow refresh rate. So it means that when you observe, when you don't observe proper visual ergonomics in your space, in your workplace, then you will really have symptoms. So just to inform everyone, the correct sitting posture is this one. So if you notice, the correct angle, just take note of this one, this monitor. The distance between your eyes and the monitor. Let me just do something for a while. Okay. So if you notice here, this distance should be the minimum over here. And the angle of the monitor and the angle of your eyes should be parallel to avoid any eye problems. And as well, take note of the posture, seating posture. It should be 90 degrees, more or less, at least 90 degrees. And also for the chair, should have a backrest and armrest as well to have a proper and more comfortable work. And for your legs, the thighs must be parallel to the floor. And lastly, the feet also should be parallel to the floor at least. Okay, and then make sure also that you take every visual breaks at least 20 to 25 minutes. So just to highlight and just to inform everyone that the proper distance should be at least an arm's length. And also the viewing angle as well, take note, that's at least approximately 20 degrees. And the most important thing as well is that the top of the monitor should be eye level. Okay, so imagine if the monitor is up here and your eyeballs are actually looking up there, it will actually, our tears actually evaporates more, because when we look here, a little down, our eyes are not very widely open. So when you look up, it's more, our eyeballs are more exposed, causing dry eyes or leading to dry eyes. Okay, so for some solution again, according to the World Council of Optometry, if these are the common symptoms again: eye strain, headaches, blurred vision, dry eyes, neck pain, shoulder pain. For that, of course, you need to blink frequently. So make sure that you blink at least 15 times per minute. And then you have to adjust your monitor. Your monitor, so eyes should be 20 to 28 inches from the screen and 4 to 5 above the center of the screen. And make sure you sit comfortably with correct posture, and you adjust your surroundings to avoid glare. So if you work at home, if you work from home, and then your room is not well lit, the brightness is only in front of your screen, it can aggravate your symptoms. Make sure you have well-lit room. If maybe in some cases, if your family members are already sleeping in your bedroom, then perhaps you can put a lamp beside your screen, your monitor or laptop. And also to follow the 20-20 rule, or every 20 minutes, we usually advise our patients or anybody who uses a computer to follow the 20-20 rule. You might heard this rule, so let me remind you again. So it's taking a break every 20 minutes, look at far for 20 feet for 20 seconds. So if you take this rule, take a break, you won't experience those symptoms. And as well, when you blink often, dry eyes will not happen. And also over here, take a break of your phone. Usually when I have seen some patients wherein they say they work online for 8 hours a day. And then I ask them, what do you do during your break time? I use my phone, doc. I use my phone. And then when I work, I go back to my laptop. Still, there's no break time over there. Okay, so just try to make frequent mobile breaks as well. Okay, but if your symptoms continue to persist, you need to see your eye doctor. So that's it for the computer vision syndrome. Now, let's proceed to this very interesting topic, which is myopia. Myopia is nearsightedness or short-sightedness. It is one topic that is actually talked globally, discussed globally, because of the effects of uncontrolled myopia or uncorrected myopia. So we're going back to basics. Myopia is one of the refractive type of error, wherein refractive error meaning we have some myopia or nearsightedness or short-sightedness, hyperopia or farsightedness, astigmatism, and presbyopia. So basically, myopia is our topic for tonight. So this is blurring of vision at far. Okay. So this is how a myopic patient can see. A hyperopic patient can see, which is blurred vision at near and clear at far. And for myopic patients, clear at near and blurred at far. Whereas astigmatism, you can still see, but it's glary, a lot of distortion, scattering of light. Okay, so when maybe some of you has astigmatism, definitely can see this kind of vision. And for the presbyopia a while ago, it's actually blurring of vision because of aging. When you reach about 40s, you will experience or you might experience blurring of vision at near. But again, my topic is about myopia. So just to give a very quick review or anatomy of the eye. So normally when we look at something, it's focused on the retina. So when we see, it's directed here on the retina, this yellow part. But for myopic eyes or nearsighted eyes, the focus is in front. That's why their vision is blurred. So when we do correction, myopia correction, we are bringing the focus here on the retina. So if the patient will say, doc, my prescription is actually this one, this high, but they said we have to reduce it, undercorrect it. Actually, it's not good because we have to make sure that the focus will bring it closer or even here on the retina. So that's a myopic eye. Okay, another picture. This is a normal eye. A myopic eyes, the focus is in front, and over here, a very high myopic eye. So the eyeballs are actually elongated. So our normal eyeball length, just to let you know that the eyeball length is approximately 23 to 24 millimeters or 2.3 to 2.4 centimeters. So for myopia, we usually assess the risk of onset. We also assess the risk of progression. It means that we have to ask the patient, especially for the parents, if one or both parents are nearsighted or myopic. So if one parent is myopic, according to studies, there is a 3 times risk to develop myopia by age 13. And for the refractive error, this means the grade of the eyes. If it's more myopic than age normal or progression worse than 0.75. So this means that every age manggod has a normal eye grade. But if the patient has already this not normal or higher than normal, then that could be a risk of having myopia. And I also want to stress out here the near activities. So for near work, we know that a while ago, I've given you statistics and data about active social media users, also the number of, the percentage of online distance learning. So it means that our eyes, teachers and anybody or kids, anybody actually are excessively using our eyes at near and less already outdoor time. That's because we know that it's pandemic. We need to be safe. We cannot go outside. That's why number of myopic patients that we've seen recently for the past year has been increasing. And another factor as well, if the ethnicity is East Asian. So this is the risk of onset. So this one, for the progression, if the patient has already myopia or nearsighted or eye grade, we also need to check if again, both parents ba are nearsighted or one parent lang ba. And then for ethnicity again, so same more or less similar factors or as risk of assessment. Okay. So, okay, so over here, as if you see a -1, this is how a -100 patient normally sees. A -300, a -600. So by looking at this photo in front of you, their vision is actually very blurred if it's 6. What if you miss the chance of having an eye checkup, especially at a young age? So if you notice some kids or maybe anybody, your loved ones, your friends, maybe mabanggaan sila when they try to play and then mabanggaan kanila, that's probably because they have blurred vision. And some research also says that there are some learning disabilities as well that were misdiagnosed just because their vision is actually blurred lang the eye. Okay, that's why it's very essential to have vision screening at an early age. So this one, the next slide, this is a very, very important statistics and data. So this one, this figure, this one, the WHO estimates that 52% of the population, of our global population, will be myopic. 52. But right now, 2021 already, but in 2020, year 2020, approximately there is a 2.5 billion myopic eyes or patients. That's 33% of the global population. So it's actually been projected already. And then this is myopia. Myopia meaning below 500, ang grado. And then next would be, we have another data here, high myopia or above 500. So again, approximately this 2020, we have 4% of the global population is myopic, highly myopic or highly nearsighted. And that's approximately 300 million. And again, it's projected to increase at 925 to become 925 million. So this data was done by adopted by WHO or World Health Organization and Brian Holden Vision Institute at year 2016. So this data was still in 2015. They adopted it in 2016, but this was before the pandemic. Okay, so definitely after the pandemic, during the pandemic, we had a lot of nearsighted patients already. So definitely this percentage and this data will be higher. Okay. So why am I saying about these statistics, the prescription? That's because they have sight-threatening conditions as well. So if the patient has, if somebody has -100 to 300 prescription or grade, there is a 2.1 times the risk of developing this cataract, and retinal detachment 3 times 1 risk, 3.1 risk. The myopic maculopathy or the back part of the eye, there's 2.2 risk. But if the increase of the prescription increases, the risk also increases. That's why we are advocating for a myopia control to control the progression of myopia, so that there will not be some sight-threatening conditions in their later lives. So if you're wondering how does a cataract patient see, and this is the picture. So again, posterior cataract, it means the back part of the lens is this one. It's a little cloudy in the central part. This is the back part. And how and what do they see? It's cloudy vision. And the next, how about retinal detachment? So this is what we see in a highly myopic eye, taas kayang grade. So this is the retina. Retina actually is a light-sensitive layer of our eyes responsible for actually sending impulses, meaning whatever we see, it's already must be focused on the retina, and the retina, from there, signals will be sent to our brain, and then we interpret it as clear or blur. So this is a very, very important part of our eyeball, of our eye. So there's a detachment. And what do they see? Something like that, like a curtain-like vision, and some floaters over here. And lastly, myopic maculopathy. So again, this is what we see. This is the nerve, our optic nerve. You see some patches yellowish here because of the stretched eyeballs, elongated na taas na kaayo, that will happen, myopic maculopathy. So on the central part of our eyes, something is happening there. You see the yellow ones there. So it's basically central part of our eyeballs has a problem. So what do they see? Since the macular area is at the middle of part of our eyeball, middle po the alang vision ang ma-affected. So that central part blur. Okay? So it is very important to have your kids checked to make sure that those conditions will not happen in the future. So how often should a child have an eye exam? So according to organizations, internationally and locally, the first eye exam of a child should be at 6 months old, and then 3 years old, and then 5 to 6 years old. This will be the kindergarten age. And then every 1 to 2 years, depending on the case. So basically, we have to have our kids' eyes checked good and screened, and of course, assessed thoroughly as well. And there is this national law. It's RA 11358. This is a National Vision Screening Act, wherein this promotes every Filipino's full potential through good vision by creating ways and means to address vision problems, including blindness, especially among children. So this one is established under the Department of Education, which is primarily intended to screen the eye vision of kindergarten pupils. So this is the National Vision Screening. So it means that teachers are trained to screen kindergarten pupils. Okay, so what is our usual advice? So for those patients or for anybody here katong wala pa'y developing myopia or is afraid to develop myopia ang mga kids, our advice is spend time outside, at least 90 minutes outdoors. Be sun smart, in short, and be active, okay? And then also follow the 20-20 rule. That's every 20 minutes, take a break for 20 seconds. And then elbow rule. So maybe this is the first time that you've heard elbow rule, but let me just demonstrate it to you. So elbow rule is when you extend your arm, you have to make sure that make a fist and put it here under your chin. And then over here, when you use our cell phone, that's a required distance. So this is the elbow rule. Okay, so anything closer to your distance or desired distance, must rest ang mata na, in short. And then 2-hour rule also for the screens, but there's a recommended screen time for kids as well. So below 2 years old, no screen time. 2 to 5 years old, usually 1 to 2 hours lang po. Okay, and then unsa may na, what's under the sun? Importante man ang outdoor. Why is outdoor light exposure very important? It is highly beneficial because if you've seen these numbers in front of your screens, the intensity of light, lux is the measurement of light. So some researchers measure the intensity of light outdoors. So it's actually 15,000 lux. And indoor light intensity is an average 500 only. And then 50 lux for poorly lit rooms. Pasabot, 50 lux when off ang iyong lights and then phone lang ang iyong ang light. And then also maybe a corner light or ambient light, that's only 50. So imagine if your kids or anybody of you working from home, it's only working inside your house, in your room, and then you only have 500 lux, and actually it's 15,000 and medyo bright. We actually need this much because it's important when you look at near, we look at far, medyo our pupils will be constricted manggod. But if it's very dim or poor lit, our pupils are dilated. So once it's dilated, dako itong pupils, more light rays goes into our eyes, and it's not damaging, but it will create discomfort. Okay, and the more lux, the better eyes are protected against myopia. So according to these researchers, more lux, meaning more bright environment, better para protected against myopia. So when again, this is what I told you a while ago, Pupils. Our pupils are constricted, meaning gamay siya when you're outside, constricted. So, causing mas better depth of field. So, in short, 3D na to ang vision, very good. And then, less ang nato ang stimulus, meaning dili kay ta mo focus because very constricted ang pupil. And then, this is the most important thing, why we need outer light exposure for kids. So if you notice here, high light levels of outers trigger the release of this hormone. This is an ocular hormone, retinal dopamine. It actually inhibits myopic development. So it means that sun exposure helps to increase vitamin D production. Para when the eyeballs grow, dili quick, dili fast. So slow rayahang development sa myopia in short. So that means it can really help to slow down the eye growth of the eyes. That's why very important ang vitamin D, or in short, vitamin sun. So in our practice, it's not only here in the Philippines, but globally it's been practiced already. This one, if you notice the single vision glasses, and there is also a, for a while, this one. Single vision glasses. Okay, Doc, ay tagana nato ni og single glasses, meaning correction, para mo clear ang mata sa far. So it's actually 0% control rate, no 0% efficacy. It's not effective. Actually, single vision glasses, and some also say we undercorrect the prescription because first-time wearers of glasses, it's ineffective. That's according to research and evidences. But we have some options here for glasses, glasses like bifocal, progressives, but the highest one is this kind of lens. Unfortunately, it's not available in the Philippines, but we have this one in the Philippines. So there is at least 33% efficacy rate or control rate. Whereas contact lens, the best ones here, 50% at least. It means that the prescription of the kid or anybody is controlled every year. So if the patient's prescription is actually increasing, nagkataas ang grado every year of, let's say, 100, 50 na lang ang itaas because of the help of the management. So again, without management, or single vision, there is no effectivity. Ineffective siya in short. Okay. And don't worry, if you notice a while ago, I have contact lens. Actually, it's safe to wear contact lens, provided they are assessed properly, comprehensively, and options are laid down for the parents to choose. But you'll be surprised that actually wearing contact lenses improves children's self-confidence in school, especially in sports, okay? And some kids in other countries, some kids wear at age even as young as age 8 years old. So they wear contact lens. And maybe you will say, "Oy, it's not safe to wear contact lens kay my infection." But again, according to studies, for this kind of lenses, 1 year in 1,000 wearers lang, usara ang magka-infection in 1,000. That's because of maybe hugaw ang kamot, dirty hands. And again, for daily disposable, meaning everyday throw lenses, once in 5 years lang. Ay, 5,000 wearers, I mean. Okay. So if you notice here, this is BHVI or Brian Holden Vision Institute. They have a myopia calculator. They have a myopia calculator to calculate the future grade of your kid's eyes. So to give a quick example, the age is 6 and ethnicity is Asian. And then at 6 years old, the normal or expected grade yun, because ka-develop pa man ng eyes at 6 years old, is only 75, plus 75, or in short, far-sighted ang grado. But if ever lang, an example lang, if the prescription is -50 na at 6 years old, and then they were not given the management to control the grade, so from -50, it can go up to a maximum of 900 without the correct management. Okay, average of 6.76 to a maximum of 950 or 9.5. So if you see here, this is an evidence-based calculator by Brian Holden Vision Institute. So with management, more or less, at least 49%. This is peer-reviewed, by the way. So 49% control rate if tagaan na to management. So that's a contact lens. Okay. So at least you now have an idea of the importance why we always say control, manage myopia at a young age. It doesn't mean that when you wear glasses, uy, magkataas ang grade. That there's a reason behind nga no magkataas ang grade. Okay. So again, why do we manage? Just to have a review, every 1 diopter, 100 na grado, ma-reduce yun ang chance of a lifetime risk of these conditions. Again, cataract, retinal detachment, and myopic maculopathy. So again, this is just to inform everyone that every 100 really matters. Kay bisag 100 lang na, even though that's 100, it's very, very important still to manage at a young age. Okay, so lastly, for everyone who are listening right now, if you have kids and you wanted to assess, this one is a free online tool to help parents assess and manage the risk for their kids. So you can check that out, mykidsvision.org. And some take-home messages. So to make sure that when you try to work from home and even your kids, please observe proper ergonomics, viewing angle and everything, the distance, the lighting. And if you have symptoms, don't ignore them. Go to your eye doctor, have an eye exam, and regular comprehensive eye exam is actually always recommended. And then take care of your eyes. We also need to eat right, okay? Bright colored veg and fruits are better. And always remember the 20-20 rule, okay? 20-22, why is it 2? Every 20 minutes, look at far for 20 feet for 20 seconds, have a break, okay? And the 2, number 2 there, it means you have to have a 2-hour break or 2 hours light exposure, especially for kids. Blink at least 15 times as well. And remember the elbow rule, don't forget that. It's not only for kids, it's actually for everybody listening right now. And proper lighting. Okay, so if you make sure that you followed all these, then you might not have any problems. But again, if you have the problems, you have to make sure now you have to go and see your doctor in short. Okay, so once again, thank you so much. And that concludes my talk.
So thank you very much, Dr. Rheza Tabasuares. Surely your talk wasn't only full of information that not only equip us but to help others, but it's also very practical as well. Now, we ask Dr. Rheza to stay with us for the Q&A later. Meanwhile, we call on Ms. Judea Taring of the Dumaguete City Host Lions Club International to introduce our next guest for tonight.
So, greetings to all of you. We will be hearing from a high-achieving doctor who has a budding yet already successful career in ophthalmology. She's a board-certified ophthalmologist who graduated from Silliman University Medical School with a degree of Doctor of Medicine last 2013. She completed her residency in ophthalmology at the Cardinal Santos Medical Center in San Juan City, Metro Manila last 2018, where she was the chief resident and had an overall rank of 9th place in the nationwide in-service exam. Our speaker went on to have her Medical Retina Clinical Research Fellowship at the Singapore Eye Research Institute, or otherwise known as the Singapore National Eye Center, last July 2019 to October 2020 in Singapore. She's not only a diplomate in the Philippine Board of Ophthalmology, but she's also certified internationally with the International Council of Ophthalmology. She is a member of the Royal College of Surgeons of Edinburgh, which is based in the United Kingdom. Our esteemed speaker is currently affiliated with all the hospitals in Dumaguete: ACE Dumaguete Hospitals, Fred Hollows Eye Clinic at the Negros Oriental Provincial Hospital, Holy Child Hospital, Negros Polymedic Hospital, and at the Silliman University Medical Center. Everyone, please help me give a warm welcome to our speaker, Dr. Janice Marie Jordan-Yu.
Hello, everyone. Good evening. Allow me to share my screen for a while. Thank you again, Judea, for a very nice introduction. So let me just navigate through this. Okay. So thank you again, Fred Hollows and Dumaguete Lions Club, for allowing me to share one of the a very close topics to my heart. So it's diabetic retinopathy. So it is the leading cause of preventable blindness all over the world. Let me just start. Okay, so for my disclosure, I don't have disclosures, but these are my affiliations. So even the Bible agrees that the sense of sight is the most important sense in our body. So Matthew 6:22 says, the eye is the lamp of the body. So if your eye is healthy, your whole body will also be full of light. So this month is Sight Saving Month. So I am one with the Philippine Academy of Ophthalmology and also the Vitreoretina Society of the Philippines in celebrating Sight Saving Month and creating diabetic retinopathy awareness, and campaigning for its awareness is an important part of our program during this month. So it is said that diabetes, together with its complications, is a global health problem. So currently, the WHO has already said that there are 422 million adults who have diabetes, and about 1.5 million of the deaths are caused by diabetes. So that's about 1 person in 11 citizens all over the world. So there are 3 main types of diabetes: type 1, type 2, and gestational diabetes. But all of this can create problems in your retina or in your eye. Okay, so it's in 2015, an estimated of about 415 million people had diabetes globally. And this number is projected to increase about more than 50%, approximately close to 60% in 2040. So it's projected to increase to about 642 million. So diabetic retinopathy, which is our topic this evening, is the leading cause of blindness and visual impairment in working age adults. So that includes me and some of our participants today. So it is associated with, number 1, poor quality of life, lower levels of psychosocial well-being, and also an increased risk of other diabetic complications. So the risk factors for type 2 diabetes, which is the most common type of diabetes in the world, is unhealthy diet, physical inactivity, overweight or obesity, which we are all at risk for now that it's pandemic. So we stay in the home most of the time. We eat unhealthily, and through this, without us walking around or doing some exercise because of the pandemic, then we are also at risk for this. This is coupled with our family history as well. So if you have family history of diabetes, you have an increased risk of developing diabetes. So what is the global burden of diabetic retinopathy? So it is estimated that more than 1/3 of those who have diabetes worldwide have some form of diabetic retinopathy. And in 1/3, nearly 1 in 10 have vision-threatening levels of diabetic retinopathy. This includes proliferative diabetic retinopathy or diabetic macular edema, which I will further explain later. So diabetic retinopathy is actually the #1 leading cause of blindness in the United States. So legal blindness is actually defined as 20/200 vision in your better eye. So what is the national burden of diabetic retinopathy? We have to relate it here to the Philippines. So a few years ago, the prevalence of diabetic retinopathy among diabetic patients, these are research published in the Philippine Journal of Ophthalmology in December 2005. So in 241 patients that come into the clinic, about 61.8% or 83.6% respectively has been diagnosed with diabetic retinopathy. That's a very large number or percentage. So in this study, approximately 1 in 5 patients have proliferative disease at the time of enrollment who were also at risk for visual loss. So what is diabetic retinopathy and its risk factors? So diabetic retinopathy is a complication that affects our eye, specifically our retina. So Dr. Rheza Badon has already discussed about what the retina is. So it is the light-sensitive tissue at the back of our eye. So it receives all the light that is refracted towards the retina, and this retina and the retina actually sends our signals through the optic nerve to our brain. So this is just an illustration. You can see that the light passes through the cornea first, through the lens, refracting it to the retina. And the retina is, tawag natin sa Tagalog, no? Ito yung pelikula ng mata. So all the signals from the retina has been transported through the optic nerve to our brain. So it's very important. It's a very important part of our eye. No? You can have a normal cornea, normal lens, but if you have a problem in your retina, you won't be able to see as well. So look at this. This is a normal retina. Look at it. It's like a painting. So God is very, he's a master creator and he's a master painter, no? This is his masterpiece, one of his masterpieces. So our retina is actually one of God's masterpiece. So this is a normal retina. You see, there are normal blood vessels. The optic nerve looks healthy. The macula and the sensor looks healthy, and then there is no blood, no exudates. But in diabetic retinopathy, there will be abnormal hemorrhage or blood, cotton wool spots or exudates, macular edema, or what we call hubag, no, in Bisaya, or maga in Tagalog, no, and microaneurysms, which are outpouching of vessel walls, and in later stages, abnormal growth of blood vessels. Okay, so this is an example of a severe non-proliferative diabetic retinopathy. You can see, if you compare it to the previous picture that I showed you earlier, it's very different, you see. So the blood vessels are in abnormal caliber, and also there are a lot of dot blot hemorrhages and flame-shaped hemorrhages along the arcades or our veins or our arteries that supply our retina. So pangit po yung severe non-proliferative diabetic retinopathy. So in later stages, proliferative diabetic retinopathy, wherein because your retina is not supplied properly by blood, there will be areas of ischemia or hindi na papadalhan ng blood ng ating katawan, no? So it will increase our vascular endothelial growth factors, or ito po yung components, or parang it's a little hormone, no, not a hormone, but components ng mata natin. If it increases, no, it will trigger our eye to produce abnormal blood vessels. These abnormal vessels are very fragile, and then they will bleed easily. So in proliferative diabetic retinopathy, you will see vitreous hemorrhage, or the blood with these abnormal vessels burst, and then it will produce vitreous hemorrhage, which you can see, no, in the bottom left of the optic nerve. And in later stages, tractional retinal detachment. So vitreous hemorrhage triggers membrane production. So these are epiretinal membrane production, which can pull on your retina, which results in tractional retinal detachment. So unfortunately, if you reach this stage, vision cannot be regained back to what was normal. So this is very sight-threatening. Pangit din siya tingnan, no? So here our diabetic retinopathy comes in stages. So the main thrust actually of ophthalmologists is to create awareness so that we can see or screen diabetic retinopathy at a very early stage. So in mild diabetic retinopathy and moderate non-proliferative diabetic retinopathy, they are just outpouching, some hemorrhages, but most of the time we don't need to do anything. No, ophthalmologists don't need to do anything other than observe, and then we work with our partner endocrinologist to control the sugar of the patient. But if we reach later stages, then we will have intervention. And this intervention does not come cheap, nor is accessible to some parts of the Philippines. So it's very important that we catch diabetic retinopathy at an early stage. So here are the common treatments of diabetic retinopathy. Eye injections. So most of the patients, they get put off by hearing eye injection, syempre, because it's an injection of a certain compound in your eye to lessen the growth of abnormal blood vessels. Hindi po madali na sabihin, i-injectionan po yung mata. No? Focal laser, which is available here in Dumaguete, cathetered laser, and vitrectomy. Vitrectomy is just like laparoscopic surgery, but inside the eye. No? So it's a very subspecialty procedure. So in stages of diabetic retinopathy, here are what we usually do as eye doctors. So in earlier stages, like in mild and in moderate non-proliferative diabetic retinopathy, we just observe and monitor. So this is the best time that you can screen patients so that you can still prevent them from developing severe. Because once severe proliferative diabetic retinopathy ensures, or if it worsens to severe, then we consider if we do laser. So at this stage as well, macular edema o maga sa sentro ng retina is usually treated with anti-VEGF injection. Ito po yung sinabi ko earlier, na injection, you inject a certain compound inside the eye. Tapos, in later stages, proliferative diabetic retinopathy, laser is a must. It's pan-retinal photocoagulation, and if with macular edema, anti-VEGF injections or the injections inside the eye. So this is what we do in pan-retinal photocoagulation or laser. So because in diabetes, the peripheral of the retina is usually ischemic or wala pong blood flow, we try to redirect blood flow towards the macula and also prevent the retina from forming abnormal blood vessels by filling it with scattered laser. So this is what a scattered laser looks like. So this we consider it doing in severe non-proliferative diabetic retinopathy, or it is a must in proliferative diabetic retinopathy. So this is to prevent complications which I showed earlier of tractional retinal detachment. So what are the risk factors in diabetes? So the non-modifiable, for example, is puberty, pregnancy, family history. But the modifiable risk factor that can prevent visual loss in diabetic retinopathy are hyperglycemia, or pag mataas yung blood sugar ninyo, hypertension, pag mataas yung blood pressure ninyo, dyslipidemia, or if mataas yung cholesterol, or other lipid, or your lipid panel has some abnormalities, and obesity. So all these four is actually modifiable. Kaya visual loss in diabetic retinopathy can actually be controlled or be prevented. So at a very late stage kasi, we are at a loss of what to do then. So prevention is still better than cure. So here are the other, this is just a other risk factors that we want to control in diabetic retinopathy. I want to highlight though smoking. So smoking also affects diabetic retinopathy, or actually it worsens it. So other than the metabolic triad that you have to control, other modifiable risk factors are vices. So smoking and also inuman, or like alcohol drinking. So these are very important to note, okay? Because other than the blood glucose, if you have a controlled sugar, if your blood pressure is increased or your lipid profile is abnormal, diabetic retinopathy can still worsen. Okay, so this is just the omnious octet of diabetes. So it's very important that we work with our endocrinologist, internal medicine, and our family medicine partners to control hyperglycemia in diabetes so that we can prevent these complications, not only in the eye, actually, but in our liver, brain, no? Liver, brain, and our kidneys, and even our heart. So what are the complications of diabetic retinopathy? So the three main complications that I want to discuss, there are actually more, no? But these are the three complications that I want to discuss with you. So diabetic macular edema, diabetic macular ischemia, and the tractional retinal detachment, which the picture that you saw earlier, no? So when the doctor looks at your retina, actually, no, the central part is your macula. So this is the part, is the most important part of your retina because it is your assigned, no? This is the area where your central vision is assigned. So any problem in the macula, then vision is also threatened. So this is edema, no? Diabetic macular edema. So the macula, or the central part of your retina, will be maga, no? It will be edematous. So this, no? This is where, no? Yung kanina, Dr. Rheza Tabasuares already told you that the light from the cornea through the lens has to be directed towards the macula for optimum vision. So in diabetes, no, this area can be swollen. You can just imagine looking at a person and then not seeing in the center. So this is very, very troublesome in diabetic retinopathy. So the treatment involves eye injection. No? So for this to be prevented, no, it's very important that you control all those modifiable risk factors so your risk will be decreased. Diabetic macular ischemia, on the other hand, there will be no maga. It will just be that your macula will continue to will die out because of poor blood flow. So it will atrophy, kung sa medical terms pa. So maninipis po siya, no? So a normal fovea, no, has an area where there is no blood flow. But in diabetic macular ischemia, because of the poor blood flow, this increases. That means, no, if you're a patient and then you have diabetic macular ischemia, no, you will see a dark spot in the middle of or in your central vision. And unfortunately, there is no treatment for diabetic macular ischemia. And visual loss is usually permanent. So you will have a permanent black spot in the middle of your vision. So this is one of the researches, no, done in Singapore National Eye Center. So it is said, no, that diabetic macular ischemia can be observed in increasing the alterations in the retina microvasculature or in the foveal avascular zone increases with increasing severity of diabetes retinopathy. So these changes are also correlated with reduced retinal sensitivity, or in other words, reduced vision. So here is another research that which I was part of, no? So this says that if you started with diabetic macular ischemia today, it can still worsen in 1 year, and your retinal sensitivity will also worsen over the year. So it's very important. Diabetic macular ischemia has to be prevented. So this should be coupled with not only controlling your diabetes, but also your hypertension, because hypertension can result, or it's those with hypertension, uncontrolled hypertension, is more at risk with diabetic macular ischemia. Okay, and the last, but not the least, actually this is the most worrisome complication of tractional retinal detachment, of diabetic retinopathy, is tractional retinal detachment. Just imagine your retina just like a tissue paper, and it's being crumpled. So this is the late stage in diabetic retinopathy. Ang pangit po. So it's very important that we raise awareness that diabetic retinopathy has a propensity to do this inside your eyes. So if I want you to reimagine what a normal retina looks like and compare it with this. So just imagine being a doctor seeing this in your clinic. So it's actually disheartening. No? So for this complication, it needs vitreoretinal surgery. So in Negros Oriental, in the whole Negros Oriental, there is still no local vitreoretina surgeon. So imagine catching patients like this in your clinic and not being able to have someone to refer to in the province, especially now that it's pandemic. You have to tell the patients that, oh, I need to refer you to Cebu or in Manila because we cannot do your surgery here in Dumaguete. So I have a lot of patients. So a lot of patients that I had to refer. So most, if not all, those that are in the dialysis unit has some form of tractional retinal detachment, as I observed sa patients na pumupunta sa clinic. No? So it's very disheartening actually to find patients at that stage, because we can do diabetic retinopathy screening. So in diabetic retinopathy screening, the major goal is to catch this retinal complications of diabetes in earlier stages. So we can prevent these anatomic damages that can occur in the future or worsen in the future. So here is the recommended eye examination for patients with diabetes. So in type 1 diabetes, or the juvenile diabetics, it's usually 3 to 5 years after diagnosis. And then if proven to have no diabetic retinopathy, then you have to follow up at least yearly. In type 2 diabetes, however, it has to be at the time of diagnosis, because type 2 diabetes is usually catched at a later stage. So usually it has been developing over 5 to 10 years. So if at the time of diagnosis, you're not diagnosed to have diabetic retinopathy, then see an eye doctor yearly to check your retina. And in pregnancy, because pregnancy hormones can actually worsen diabetes, it is recommended that before conception or in early trimester, where our hormones are very high, that we see an eye doctor for screening in diabetes. So those with gestational diabetes has to be checked before conception or in the early first trimester. So then, those with moderate to severe diabetic retinopathy, then we see every 3 to 6 months. Or those with at the later stages, we see every month. Or those with complications like what I said earlier. So a retinal exam involves an eye doctor looking at your retina. So it has to be that your pupil be dilated so that we can see the whole retina. So this is accomplished by your eye doctors So usually they dilate you with eye drops and see the back of your retina using a special lens or special equipment. So to end, no, that was a very short talk, but to end, let me share to you this, no, screen and track. So this is developed or by NIH, no. So protect your vision from diabetes, have a dilated eye exam every year, and follow these steps to keep track, no, your health in track. So TRACK. T, if you're diabetic, take your medications as prescribed by your doctor. Don't resort to herbal medications, no? And R, reach and maintain a healthy weight. A, add more physical activity to your daily routine. I know this is very hard during the pandemic, but try, no? C, control your ABCs, the glycated hemoglobin, fasting blood sugar, or blood pressure, and cholesterol levels. And K, please kick the smoking habit, not only smoking, but also alcohol. Okay, so remember, for diabetic retinopathy, screen and track. Okay, so to end my talk, no, I want to acknowledge the volunteers in Fred Hollow's Eye Clinic, Dr. Rheza Badon-Tabasuares for optometry, Dr. Lorenzo Veracruz, our fellow ophthalmologist, my husband, Dr. Daryl Jason Yu, and also the previous volunteers in Fred Hollow's Eye Clinic before, Dr. Florencita Jordan, Dr. Albert Flores, and Dr. Gerardo Cinco. Okay, so this is just a picture of the team in Fred Hollow's Eye Clinic in NOPH. So this is Kira, one of our nurses, and Arlene, one of our OR nurses. Thank you very much for listening, and I'm ready to take your questions. Thank you.
So thank you very much, Dr. Jordan-Yu. Certainly, your talk is very relevant, especially in this time when diabetes is very prevalent, especially that certainly we have family members that may be affected with this. Now, can we call on both our speakers again to join me as we try to answer questions that have been coming in when you were presenting the talks? Okay, so we have some questions here. First up, it says, "Hi Doc, I am from Cebu City. Can you please elaborate on the redness as a CVS symptom? I have red eye, outer left eye. Now my office mate's description earlier today was nagkadugo imong mata, but di siya katol, haplos, or sakit. I was actually working with a red eye when I came across a post about this talk, hence my attendance tonight. Is there a medicine or drug that I can take for this? As a backgrounder, she says that she works for the government and spends most of her time in front of a computer or a laptop. So anybody want to take this question?
Yeah, just for a while. For this question, he says CVS symptom redness. So for the
Yes.
redness, it can have a lot of reasons. Firstly, redness due to dry eyes could be one, but the one you said, nagkadugo ang mata, maybe that's a different kind of redness. That could be maybe Dr. Janice Jordan can elaborate, maybe a hemorrhage perhaps for the redness. So Dr. Janice can add something on that.
Okay, so usually eye redness is one of the most common symptoms that patient comes into the clinic. So there are a lot of causes of red eyes. So we have conjunctivitis, or infection or inflammation of the conjunctiva or the skin covering your sclera or the white part of your eye. And the most common one is the subconjunctival hemorrhage, wherein if your blood pressure is not controlled, the small blood vessels in your eye can burst, and that is what we call the subconjunctival hemorrhage. It is actually very benign, but most patients get afraid by it because it looks very parang monstrous ba? It's very red. So it's very benign, but usually it goes away on its own without any treatment. So we usually just prescribe lubricant, no, to make your eye more comfortable as it resolves. So it's just like a bruise in your skin. It involves stages of clearing. So usually it turns yellow after 2 weeks and then just resolves on its own if it's subconjunctival hemorrhage. But it's always best to see an eye doctor if your eye is red, because it can be in other cases, no, conjunctivitis or the inflammation, or uveitis, which is the more serious thing. It involves the inflammation inside the eye, which can also present as red eye.
When you say lubricate the eyes, Doc, because Doc Rheza also mentioned this for dry eyes. What do we actually use for lubricating our eyes, and do you recommend some brands for it?
Dr.
Usually
Rheza can
depends.
expand on it.
Yeah. For, if we find or maybe diagnose a patient or patients with dry eyes, it's always we usually check to assess what type of dry eyes, because there are eye drops that are meant for that specific dry eye. So it's a lubricant is not good for everyone. It's case to case basis. That's why we still need to assess properly, to properly give the advice as well on what type of eye drops we recommend.
Okay. We move on to the next question. The sender says, good evening. Since it's related about our eye vision, is astigmatism curable first? So in my case, I have grade 200 in my left eye due to astigmatism and vision 20/20 in my right eye. So does anybody want to take this question?
So is astigmatism curable? So is astigmatism can be cured? That's a question. So basically, astigmatism is an irregularity on the curve of our cornea or the front part. So that's the most common type of astigmatism. So dili same ang curves over here about 90 degrees at 180. So it means that our eyes are not perfectly made lang yun. So if somebody has astigmatism and if the vision is 20/20 or perhaps okay, then it's okay. And as long as your vision is corrected correctly, in short, giving the right prescription, then your vision is still good. So you don't need to worry or panic if you have astigmatism. But when you say cure, it's not curable because it's there.
So thank you very much, Dr. Rheza. How about this question about blue light glasses? Do they work? Do you recommend them for using in screen time? And what actually, to add to that, what actually is blue light?
Maybe I can try to expound this question. First and foremost, blue light glasses, it's actually very controversial, not just in the Philippines, but globally, because there is no very heavy evidence or studies about that. But there are some companies research about blue light, and this blue light actually is a visible light in the spectrum in our color. So the blue light, they found out that there is a healthy blue light and a bad blue light. Okay, so some companies, they said it blocks the unhealthy blue light. So this unhealthy blue light, so what does this do to our eyes? So according to their research, the blue light actually makes us awake, in short. So it actually also disrupts the circadian rhythm. So if you notice, when you use your phone without any glasses or protection, you tend to sleep late. In short, dili ka katulgon because you keep on staring and staring at it. So that's what the blue light does to our eyes. That's why some companies claim that the blue lenses block the tuan and then it protects their eyes, in short. But again, just to clarify, there's no heavy evidence, but it can still help, especially for the glare of the screens.
So a comment from Dr. Maria Victoria Rondaris. She says that blue light is actually found everywhere, not just mobile phones or monitors on our computers, but even our ordinary light for our homes.
Yes,
So
correct.
very good.
Yeah, that's
Wow.
correct information. So again, blue light is not only found in our screens, but anywhere. And the
So
biggest source is our sun. Actually.
Yes.
yeah, so it is really recommended to wear those blue light glasses that we find usually in shopping websites. Is
Yeah,
it?
but it depends because when maybe you're talking about online
Yeah.
lenses, right?
Yeah.
First and foremost, we have to make sure that do you really have symptoms? Do you have focusing problems at near, or do you have maybe prescription? So if you just buy blue lenses or any lenses online, you will not know if that actually can help alleviate your symptoms. So it's still best to have your eyes checked, and proper suitable management recommendation will be given by your eye doctors.
Okay,
And
so
just to add, sorry.
okay.
Just to add, other than blue light, the most important light that you need to protect your eye from is actually the UV light. No, so the UV light from the sun can cause many things. So the UV light from the sun can cause cataracts. It can also cause or hasten age-related macular degeneration. So while you're young, no, protect your eyes from the light of UV light from the sun. So other than the blue light protection, no, mas importante po yung protection from the UV light, which you can get from sunglasses and UV coating of glasses.
Wow. So we have questions here about diabetic retinopathy.
Yes.
The first one is, what are the symptoms of diabetic retinopathy and how can we advocate the prevention of this one in public health setting?
Oh, okay. So the main thrust of the Philippine Academy of Ophthalmology is screening. So if you have a diabetic patient, please refer them to your eye doctor, no, for diabetic screening. So that is the most effective. So in Singapore, they developed a diabetic screening device, no, that they just take pictures of the eye and then the ophthalmologist or grader grades it, whether it's referable or not. But unfortunately, it's not available in the Philippines. So their incidence of diabetic retinopathy has actually cut not to 2/3 from the very high incidence that they have 10 years ago. So in diabetic retinopathy screening, no, the most cost effective is referring it to the ophthalmologist. So ophthalmologist and eye doctor, our optometrist as well, no, to check our retina. So a dilated fundus exam is a must, no, to check for diabetic retinopathy, because now in diabetic retinopathy, sometimes symptoms only appear in the late stages. So get yourself, if you're diabetic, get yourself screened, even though you don't feel anything. But the usual symptoms of late stages of diabetic retinopathy is actually metamorphopsia, or you see white lines waving. So if you look at your tiles in your CR, and then you see that it's waving, it's one of the most common things. And also floaters. So there are floaters that are benign, but in diabetes, no, you have to check whether or not you have vitreous hemorrhage. So you have to get a dilated retinal exam. So the most cost effective again in the province actually is a referral for diabetic screening through a dilated fundus exam.
Okay, so in the public health setting, it is really recommended that if a patient is diagnosed with diabetes, they have to see an eye doctor, right? So they can be advised
Screened.
more appropriately. Yes, so we'll take the last two questions. These are still about diabetic retinopathy. If one eye is affected, will the other eye be automatically suffer the same fate? One asker is asking.
Okay, so diabetic retinopathy, since the blood glucose travels to your blood, right? So both your eyes receive the same amount of blood flow. And it also will receive the amount of sugar that flows in your blood flow. So it can be asymmetric, wherein one eye is at an earlier stage than the other. But usually, no, one eye follows the other based on experience. So it's very important to dilate both eyes. No, check the retina of both eyes.
Okay. How about can diabetic macular edema be cured with just one intravitreal injection?
So based on studies, now in some other countries, it's very in some countries it's free actually. The injections are free, no, based on their healthcare. So in studies, no, it's usually 5 to 6 injections in a year. Because macular edema, if it doesn't respond to 3 injections monthly, it usually needs 5 to 6 in the year. But no, if you couple it with good control in hypertension and in cholesterol, no, sometimes we do an as necessary approach. So there are 2 approaches in treating diabetic macular edema. There's the treat and extend, wherein you treat, see the patient, see if you can extend the next dose, or do it as necessary. If you see the patient monthly, inject if he has macular edema, see again in another month, inject if he has macular edema, see again. If no macular edema, then skip the injection. So it's actually tailored approach, and it has to be in a case-to-case basis. Unfortunately, in the Philippines, it's very expensive to have eye injections. So prevention is better than cure.
Definitely, Doc. So for a more practical question to end this question and answer portion for tonight, we have Dr. Rheza. She is an optometrist, and Dr. Janice as an ophthalmologist. When do we know who to see? An ophthalmologist or just an optometrist? No, and maybe you can also share to us where we can find you if ever we need consultations for our eyesight problems.
Please go ahead, Dr.
Anyway, again, thank you for those questions. They are very important questions, relevant questions, and by the way. So anyway, both of us, for the information of everyone, we are primary eye care doctors, primary eye care providers. You can see anybody, but normally when we optometrists see something irregular or abnormal, we usually refer to them, to ophthalmologists. Then they do the treatment and further evaluation, assessment, then they do proper management to patients. But for some cases that are not pertaining to eye diseases naman, pwede naman po sa optometrist, you can also go to ophthalmologist. So it's again case-to-case basis. Yeah. But just in case you said, yeah, sorry.
It's okay. Go ahead, Doc.
It's okay. It's okay, Doc.
So optometrists and ophthalmologists should be partners in eye care. So I want to re-emphasize now. So in some countries, the relationship of an ophthalmologist and an optometrist is well defined, no? But no, there is, just like any other profession, there are overlaps. So we both have a common goal to further eye care. So whether or not you see an optometrist or an ophthalmologist, no, just make sure that you see either, and then usually our partner optometrists, they refer eye diseases to us, commonly those who are with systemic diseases, and also those that need treatment and surgery. Now, it's a common goal to further eye care in the country and also in the rest of the world.
Yes.
So thank you very much, Dr. Rheza and Dr. Janice. What a night we are having. However, all good things must come to an end. So we now call on and give the spotlight to Dr. Leland Zoila B. Estacion, the head of the Provincial Health Office of Negros Oriental, and Ms. Angeline D., the president of the Dumaguete City Host Lions Club International, to award the certificates of appreciation to our guest experts tonight. And then right after, Dr. Estacion and Ms. D will also deliver the closing remarks.
Okay. Good evening, everyone.
Hello, good evening. Maybe IT can show us the certificate. So that we can read the citation for the certificates.
Okay, so maybe while waiting for the IT to show the certificates on our screen, maybe we can ask Dr. Estacion, like how important is eye health and what are we doing in the province to promote this advocacy?
Here in the province of Negros Oriental, we are very lucky. Good evening, everyone. No, to the Lions, the City Lions, being the host of tonight's Zoom. We are very lucky in Negros Oriental that primary eye care that is already an additional program to the Department of Health, and it's the Provincial Health Office, the one implementing the program, that Fred Halos is here now in Negros Oriental. We really thank Fred Halos because they give us the equipment on what Dr. Yu is using, and also Dr. Tabasuares is using in our clinic, and then we also, Fred Halos also had financed our screening in different barangays or LGUs in the province of Negros Oriental. And we were very lucky also that we went to a tour to Tarlac, no? And then our nurses also were, our nurses were trained by Fred Halos. So this program now here in the province is still ongoing, even though there's the pandemic.
Wow, so thank you very much, Doctor. I think the certificate of appreciation is now flashed on screen, so you may present it now to the expert guest that we have tonight.
Who will present, me or?
I think you can, ikaw lang, Doc.
Okay. Thank you so much. So this certificate of appreciation is given to Dr. Rheza Marisse Badon-Tabasuares for sharing her valuable knowledge as guest speaker about what you need to know about computer vision syndrome and myopia. On 18th of August of the year 2021, signed me, myself, Lilanzuela P. Estacion, Dr. Maria Victoria Ronderes, Dr. Miss Angeline S.D., and Francisco M. Martinez. Dr. Tabasuares. And the other one is also a certificate of appreciation to Dr. Janice Marie Jordan-Yu for sharing your valuable knowledge as guest speaker about the leading cause of preventable blindness, diabetic retinopathy, on 18th of August of the year 2021. Signed me, myself, Dr. Victoria Rondares, Miss Angeline D., and Francisco Ramirez. Martinez. So I just want to also extend, because Doctora Yu is the daughter of Doctora Jordan, which is the they were the prime movers, of the Fred Halos eye clinic in the Negros Oriental Provincial Hospital.
So thank you very much, Dr. Estacion. You may now begin delivering the closing remarks, and then you will be followed by our president, also Ms. Angeline D.
Okay. To Dr. Tabasuares, Dr. Yu, Janice Marie Jordan-Yu, and to Miss Angeline D. Good evening, everyone. Eyes is very important in our health, no? As a person, we really need our eyes, no? Mausog jud ang ato ang ang atong life if we cannot see, okay? In the school, we really found many slow learners. We thought that they are slow learners, but during our primary eye care program, we saw that these slow learners, the problem is eyesight, no? So dako jud kay tabang, no, in the province for our school children na we have this program. You know, we have the most important thing is we have things that we have to keep on to us to have a healthy eyes, no? So mo ni ako na learn during the session. Eat healthy and balanced diet, maintain a healthy diet, get regular exercise, wear sunglasses or the blue glasses, wear protective eyewear, avoid smoking, know your family medical history, and know your risk factors, no? I think this summarized everything sa tanan nga lecture sa atong mga guest speaker this evening. So I hope to all who are here now that will just not stop with us, but we have to share this to all our people, no? Especially the health workers. Na we have to share this to our co-health workers so that what we are talking now can be prevented. I thank you very much.
Okay, as I close this event, I hope that all of us will not lose sight, no pun intended, of its purpose, which is to increase awareness of the importance to keep our eyes in good health. The Dumaguete City Host Lions Club looks forward to engaging all of you in other similar activities. While many people value their health, the eyes is an organ that is typically not among those on the top of the list to take good care of. Let us all change this perception. I thank you all for joining this event and have a wonderful evening. Thank you.
So just like that, we are now at the end of tonight's webinar. We are also grateful for making this event possible to the Provincial Office of Negros Oriental, the Fred Hollows Foundation Philippines, the Dumaguete City Lions Club International, and the Negros Oriental Chamber of Commerce and Industry. So this webinar will be accessible for replays in the Dumaguete City Host Lions Club International Facebook page and will soon be uploaded in YouTube in the Learning Event Series channel. For those who would want a certificate of attendance for this webinar, instructions will be given via the poll questions as you leave this webinar, or you may click the link posted in the chat box for a direct link to the Google Forms. Please fill in your information correctly. We strictly adhere also to the Privacy Act for all the personal data submitted. Your e-certificates will be sent within the week. We are further reminding everybody that we have not applied for CPD units for this activity. However, you can attach the certificate for this event as part of your self-directed learning. On that note, we finally end this webinar. Have a good night. May God bless you and protect us all and our families and friends for always. Have a good night.